Hi, my name is Pauline Richardson. I'm one of the nurse educators here at the Brooklyn Hospital Center, and I'm doing the Ask a Nurse web series, which is hosted by TBHC Nursing Education Department. My topic is influenza vaccine, Race to the 200M campaign. First, we look at the statistics, and we're looking at the period between 2017 to 2018, when we had a pandemic-like numbers. The estimated number of flu illnesses were 29 million, which is more than the combined population of Florida and Texas. Estimated number of hospitalization was 960,000, which is more than the number of hospital beds here in the United States. The estimated number of flu deaths during that period was 79,000, which is more than the average of people attending the Super Bowl each year. Now we're going to look at the transmission, which is primarily droplet, but it can also be contact or airborne transmission. The incubation period when the symptoms occur is usually 1 to 4 days after the infection occur, and the peak symptom is usually present within the first 3 to 7 days of the illness. The symptoms are fever, cough, fatigue, myalgia, which is muscle pain, nasal congestion, sore throat, nausea, vomiting, headache, confusion, and diarrhea. Now we look at the complications of the flu. One could develop pneumonia, sinus, ear infection, also myocarditis, which affects the heart, and encephalitis, which affects the brain. One could develop severe sepsis, which is a very bad infection, or multi-organ failure, where the organs begin to fail because of the infection. Now we're going to look at the high-risk group. Pregnant women during the second week postpartum are high-risk group, high risk. Also, children under the age of 2. What are the comorbidities for developing the influenza? Chronic lung disease, cardiac disease, obesity, chronic renal disease, immunosuppression, advanced liver disease. Individuals who live in long-term care facilities and also nursing homes are high-risk groups. Also, are adults who are greater than 65 years old. Let's talk about the influenza vaccine. There are 3 new strains in the influenza vaccine this year. Everyone, especially older adults, should receive a licensed age-appropriate influenza vaccine. There are many types, which include egg-based or culture cell-based. Special consideration must be taken for individuals with suspected or confirmed COVID-19. And so the recommendation is that these individuals should wait until the acute illness has resolved before getting the flu vaccine. Now we're going to talk about the special consideration based on age. People age 65 and older should receive high-dose influenza vaccine, and there are 2 different brands out there. There's the Fluzone and also the Fluid. The side effect of these vaccines are pain, redness, or swelling at the injection site, headache, muscle ache that resolve within 1 to 3 days. For individuals who are pregnant, they should receive a flu vaccine, not the nasal flu vaccine. People with egg allergy can receive any licensed recommended age-appropriate influenza vaccine that is otherwise appropriate. Those with egg allergy should be vaccinated in a medical setting where they can recognize and manage severe allergic reaction. And so there are 2 completely egg-free flu vaccines which are optional. Breastfeeding women can safely get the flu vaccine. The flu vaccine protects not only the mother, but also the baby who are younger than 6 months old. Children less than 6 months of age have the highest risk of getting hospitalized from the flu. There is no flu vaccine approved to give to them as yet. But during pregnancy, expecting mothers who get the flu vaccine can protect the unborn babies and give them immunity from the flu when they're born and up to 6 months of age. Children 6 months up to 8 years old, the recommendation by the CDC is that they should receive the flu vaccine in October before the flu spreads. Vaccination during the winter months up to January will still be beneficial, but early vaccination is the key. It is recommended that they should receive 2 doses of the flu vaccine. If a child only receives 1 dose or first time getting the vaccine, they should get a total of 2 doses. If a child received 2 doses in the past, then he or she only need 1 dose of flu vaccine this season. It is very important to consult with the primary care physician on the vaccination dosage and also the plan. Now let's talk about the side effects of the vaccine. Those who receive the flu shot can develop muscle ache, nausea, headache, fever, soreness, or redness at the injection site. Those who receive the nasal spray can develop muscle ache, vomiting, headache, wheezing, or runny nose. The race to the 200 million flu vaccine, just take note that every year we face a serious threat, the flu. This year we're racing to beat it. The American Nurses Association and musical artist, actress, and producer Rita Wilson have launched a national program to increase the urgency of flu vaccinations, particularly among the approximately 200 million people over the age of 50 who are most vulnerable to influenza and its complications. We are calling on you to do your part in the fight against the flu and help us get to no less than 200 million Americans vaccinated. Get your flu shot today. For more information, please go to the race to 200m.com. Please call your provider as soon as possible if you are having acute symptoms with or without fever, so you can be tested or vaccinated. You can also schedule an appointment with the Brooklyn Hospital Center using MyChart or open scheduling. The links are www.tbh.org or mychart.tbh.org. And these are references that you can use to get more information about the flu vaccine. We are here to help you. Please leave your message, questions, and comments here on this link, and we will respond to you. Thank you for watching. Please look out for one more session this month.